Hi everybody, I'm Dr. Amelia Aldao. I'm a licensed clinical psychologist, and today in Therapy Corner, I want to talk to you guys about what is generalized anxiety disorder, or GAD. GAD is one of the main anxiety disorders, and it affects a lot of people, roughly 7 million American adults. And yet, there's a lot of confusion about what GAD is and about what GAD isn't. So today, I want to spend a few minutes covering the basics. I'll tell you guys about the symptoms so that you can get a better sense of what GAD tends to look like. And then, of course, I'm going to be covering the latest research. Here, I'll tell you about some of the mechanisms driving GAD, making GAD worse. And of course, I'm also going to be telling you about some of the latest CBT treatments. So I hope you stick around. So what does GAD look like? Well, GAD is characterized by being in a constant state of worry, anxiety, and stress. People with GAD are constantly worrying about a number of things: family members, friends, co-workers, finances, health, the planet, you name it. In fact, GAD sometimes is called the what-if disorder because people with GAD are constantly going, what if this happens? What if that happens? What if this doesn't happen? And so on and so forth. Now, there's a very important point here that I like to make about worries. This is something that I've written about extensively in my papers, and so have many other researchers. And this is the point that worries sometimes are very adaptive. They help us run scenarios in our mind. They help us prepare for the future. Right, so let's imagine that you want to get good grades in school or that you want to get a particular job. You worry about it, and now that leads you to action. You're studying harder or you're preparing more for the interviews. And then you get good grades and then you get the job, right? In those scenarios, worries were actually really helpful. The problem is that in GAD, people get trapped in a vicious cycle of feeling worried and feeling anxious. And they never quite move from the state of worrying to the state of taking action. They begin to feel paralyzed by their own fear and by their own anxiety. They get trapped in all the what-ifs. They overthink everything and they never get to take action. And the less action they take, the less confident they feel about their own skills, the more anxious they feel, and guess what? The more worried they feel in turn. So it's a very complex, vicious cycle. So how do we go about diagnosing GAD? Well, we use the Diagnostic and Statistical Manual, the DSM, which is published by the American Psychiatric Association. And according to a DSM, for somebody to have GAD, they need to be worrying about a number of things in their lives most of the time, and they need to have a hard time stopping those worries. The person needs to feel out of control. And they need to be worrying for more than 6 months. Now, this is a very interesting criterion because most of the time when people come to see us and they have GAD, they will tell us they've been worrying for years, sometimes even for decades, because GAD tends to be a very chronic condition and it tends to start in early adulthood, sometimes even in adolescence or childhood. In addition to the worries, in order for somebody to have GAD, they need to experience a number of physical symptoms. And once I tell you about it, you'll realize it makes perfect sense. So people need 3 out of 6, and again, most of the time they have pretty much all of them because they're very much interconnected. So the first one is restlessness or feeling on edge, which goes without saying, right? If you're worrying about all kinds of things all the time, of course you're going to feel restless. The second one is very closely related, and it's irritability. Again, makes perfect sense, right? When you're so anxious, when you're so tense, everything feels like a nuisance. The third one entails difficulties concentrating. And again, perfect sense, right? If our minds are constantly in the future, worrying about 1,000 different scenarios, of course we're going to have a difficult time focusing on the present. And what I think is really important about difficulties concentrating here is that I'm not talking about concentrating on really difficult stuff. No, I'm talking about focusing on TV shows or having conversations with friends. Or we have fatigue. If we're constantly worrying, we're constantly tense, eventually we feel drained. This is also closely related to symptom number 5, which is difficulty sleeping. People with GAD tend to have a really hard time falling asleep because they keep worrying about stuff. Or sometimes they wake up in the middle of the night and they begin to worry about lots of things. Many times, by the way, when people come to see us and they think they have insomnia, once we take a closer look at their presentation, we actually realize that the problem they have is GAD. And the last symptom is muscle tension, which again to me makes perfect sense. If you're constantly worrying, you're anxious, you're tense, you're going to be like this all day. That's what we do when we tense up. And when we do this for hours and hours and days at a time, we end up getting a lot of tension all over our shoulders and all over our neck. So these are the diagnostic features of GAD. Please keep in mind this is purely informational If you suspect that you or someone in your life may have GAD, please seek the help of a mental health professional. I'm listing resources below. I also wanted to tell you guys about this really interesting associated feature, which is called intolerance of uncertainty. So what do I mean by this? Well, there's many things in life, or pretty much everything in life, that is uncertain, right? We have a sense of what we're doing today, what we're doing tomorrow, what we're doing next week, but ultimately we know that everything is subject to change. Now, some of us are relatively okay with that, and some of us have a really hard time with that. Well, people with GAD tend to have a really difficult time tolerating or managing uncertainty. It makes them anxious. It makes them worry. Basically, the way we study it is by giving people questionnaires and asking them to tell us the extent to which they agree with different items, or the extent to which the items reflect their everyday experiences. So some of the items, for example, are, it frustrates me to not have all the information, or even a small unforeseen event can ruin everything. So things along those lines. And what we tend to find is that people who score very high on intolerance of uncertainty also tend to have high symptoms of GAD. And in fact, meta-analysis, which basically averaged the findings from many studies, have found that there's a moderate to high correlation between intolerance of uncertainty and GAD. It's roughly 0.5, and sometimes it can go as high as 0.7. And you don't need to be a stats whiz to know this, but basically correlations go from 0 to 1. 0.5 is a moderate, solid correlation. 0.7 tends to be on the high end. So when I work with patients who I suspect have GAD or I know have GAD, even though intolerance of uncertainty is not part of the official diagnostic criteria, I still ask them a bunch of questions about it because it gives me a better sense of how they approach life, how they feel about uncertainty, and what role it likely plays in all of their worries and all of their anxiety. So you might wonder then, where does GAD come from? And much like everything else in psychology and psychiatry, we don't have a definite answer. But we do have very cool research that has been done over the last few years, and of course I'm always super excited to tell you all about it. Let's begin with the avoidance model of GAD. This is a classic model, and it basically states that people with GAD have a really difficult time tolerating the physical sensations of anxiety. So, when your heart races a bit, or you're starting to feel shortness of breath, or you're sweating, perhaps even shaking, or you're feeling tension in your muscles and your stomach, like that kind of stuff, right? Well, nobody likes to feel that, but people with GAD have a particularly low tolerance for it, and they seek to avoid it. How do they avoid it? By worrying, by getting in their heads, by playing lots of scenarios about the future. They allow themselves to not feel sensations in the present. And this becomes reinforced over time, right? The more that people worry, the less they feel any sensations. And then whenever they begin to feel anything, that becomes unbearable, right? So they immediately go to a place of worry. What I find really fascinating about this is that it really exemplifies this disconnect that we all have to some extent between how we feel, right, and how we think. So newer versions of the model actually focus not only on avoidance of physical sensations, but emotions more broadly. So here's the idea that people with GAD have a difficult time tolerating emotions because they are unpredictable, right, and they're really difficult to control. Think about your life, right? In any given day, you probably go through lots of different emotions: anxiety, fear, sadness, anger, frustration, happiness, excitement, joy, right? And so on and so forth. Well, that's super cool, right? But it's also very unpredictable, and sometimes emotions really get in the way. So people with GAD have a very low tolerance for all of this messiness, for all this unpredictability that comes with emotions, and that's why they go to a safe place of worry. I like to use this analogy. If you go to an amusement park and you get in a roller coaster, you don't necessarily know what it's going to look like or what you're going to be feeling, right? So when we allow ourselves to feel emotions, it's almost like we put ourselves in a roller coaster, right? In contrast, when we go to our heads, when we go to a place of worry, it's almost like we go to a carousel, right? It's very predictable, it goes in circles, and it goes at a very low speed. And the more time we spend in the carousel, right, the more frightening the roller coaster becomes. So the less likely we are to go there, right? So the more time we spend in our heads, the more terrifying emotions seem, right? And the more we're going to do to avoid them. Over the years, there's been many iterations of the emotion models. The latest one is the emotion regulation model. That's the one developed by my grad school advisor when I was at Yale, Doug Menon, and he's now a professor at Columbia. And basically he talks, the model talks about how people with GAD avoid emotions, but it also talks about this fundamental conflict that people with GAD find themselves in. And this is a conflict between wanting things, right? So wanting to be in a relationship, wanting more friends, wanting that promotion at work, but also being terrified that we're not going to be able to get those things, right? So we're scared that we're not going to get to those places, that we're not going to get those things, and we worry and worry and worry and never take action, right? And we end up getting stuck in this place of anxiety, in this place of fear, in this place of worry, and we never end up going for those things that we really care about. And what I find fascinating about this is that this conflict, right, between wanting things and being afraid we're not going to get those things, that conflict plays in everyone's mind, right? Whether you have GAD or not, you've had that experience. And in my mind, this is quintessential to being a human being, right? We want things, we want to do stuff, right? But then sometimes we hear that voice in our head that says, hey, you might not get that, that might not happen for you. And that voice holds us back. So treating GAD then can be very difficult because exposure is actually quite challenging. So you might recall from my What is CBT video that when we have patients who have anxiety, we do exposure. So we help them face those situations and those objects that make them anxious so that they can work through that anxiety, right? So for example, if someone has social anxiety and they're anxious about talking to strangers, we do exposure so that they go and talk to strangers. Now with GAD, this is a lot more difficult because people with GAD are not necessarily afraid of an object or a situation, right? They're afraid of their own internal experiences, and that's why they're constantly in their heads worrying. So exposure here is very challenging, and it basically entails getting the person out of their head, right, and into their body, right? It's about thinking less and feeling more. And one of the techniques that researchers have been using in CBT is mindfulness. And if you don't know what mindfulness is, don't worry, I'm going to be doing a whole episode on it. For now, let me just tell you a quick definition. Mindfulness is a practice of basically allowing ourselves to feel things in the present and to try to not be judgmental. So it's allowing myself to feel anxious or angry or whatever it is without necessarily jumping into judging myself for having those feelings or for not having other feelings that I want to be having. And basically the idea is that, the more we practice mindfulness with GAD clients, the more we can help them get out of their heads, right? Get out of the future and more into the present and more into the feelings that they're having right now. So let me tell you about one of the recent studies for CBT for GAD using a mindfulness perspective. This is a trial of emotion regulation therapy, which is the therapy developed by my grad school advisor, and it came out in the Journal of Counseling and Clinical Psychology, which is one of the top journals in the field, particularly when it comes to doing randomized controlled trials or RCTs, which is what they did. So they had patients with GAD come in, some were assigned to getting treatment right away, and some were assigned to a waitlist control. And participants in the emotion regulation treatment got a lot of mindfulness practice and a lot of practices around relating to their emotions differently. And what they found was that treatment was very effective. So they measure end-state functioning 9 months after the end of treatment. So this is a really cool measure because it's not just about whether people are doing better right after treatment, but actually over time. And 9 months later, they found that 80% of the patients were doing much better. They didn't have GAD symptoms anymore, at least not at a clinical level. Now, this is particularly important because the benchmark, so the standard, is 50%. So these CBT treatments that are focusing on mindfulness are actually helping a lot more people, right? They're helping us increase the effectiveness rates of the CBT treatments for GAD. And of course, 80% is still far from 100%, and this is just one study, so we need to continue doing it with different populations and different types of people suffering from GAD, but I think it's super promising. So if you or a family member are seeking treatment for GAD and you're talking to the therapist about their approach, make sure that there's a mindfulness component because most likely it's going to be helpful. So this brings us to the end of today's video on GAD. I hope that you guys found the information helpful, and please keep in mind this is purely for informational purposes. If you suspect that you or people in your life may have GAD, please consult with a mental health professional. I'm putting resources below. And as always, if you enjoy the video, don't forget to like it and to subscribe to the channel. And we still need lots of help growing, so please help us spread the word about the channel. You can do so in a number of ways. You can share links to the video, or you can also share my posts on social media. I'm Dr. Amelia Aldao, both on Twitter and on Instagram. So thank you so much, and I'll see you guys next time. Bye-bye.